What is social distancing? As the situation around coronavirus disease 2019 (COVID-19) in this country evolves, we've seen the Centers for Disease Control and Prevention (CDC) issue guidance about canceling or postponing in-person events. This has led to cancellations of entire sports seasons, thousands of schools closed along with theaters, bars, restaurants, and everyone being asked to practice a relatively new term for all of us: social distancing. It's frightening, confusing, and for some, cause for anger. However, there is a public health reason for these measures. These cancellations will help stop or slow down the spread of disease, which will help to avoid overwhelming the health care system so ill patients can be cared for over time. So what does social distancing mean? According to medical experts, social distancing is deliberately increasing the physical space between people to avoid spreading illness. Staying at least 6 feet away from other people lessens your chances of catching COVID-19. Examples include avoiding mass gatherings, working from home if possible, closing schools, visiting loved ones electronically instead of in person, and canceling or postponing conferences or large meetings. Even during this stressful time, the need for blood is constant. We should all be practicing social distancing, but it's important to know that blood drives are not considered mass gatherings because they are controlled events with trained staff and appropriate safety measures to protect donors and recipients. Donating blood is a safe process and people should not hesitate to give or receive blood. You can still go out and give blood. We're worried about potential blood shortages in the future. Social distancing does not have to mean social disengagement, said U.S. Surgeon General Jerome M. Adams. One of the most important things you can do to ensure we don't have another healthcare crisis on top of the coronavirus is to give blood. We understand why people may be hesitant to come out for a blood drive, but we want to reassure the public that we are taking additional precautions to ensure the safety of our donors and staff. This includes checking the temperature of staff and donors before entering a drive to make sure they are healthy. Providing hand sanitizer for use before the drive, as well as throughout the donation process. Spacing beds, where possible, to follow social distancing practices between blood donors. Increasing enhanced disinfecting of surfaces and equipment. Employees should always follow strict safety procedures, including wearing gloves, routinely wiping down donor-touched areas, using sterile collection sets for every donation, and preparing the arm for donation with an aseptic scrub. These measures will help to keep blood recipients, staff, and donors safe.